But the majority of people will have their first Medicare eligibility at age 65. And whether or not that is their juncture to make the transition.
Welcome to the Live Greater View, a financial planning podcast produced by VLP Financial Advisors that discusses life, money, and perspective. We help clients live their best life at every stage through our VLP Live Greater partnership process. Thank you for tuning in.
All right. Well, we have a great episode on tap for us today. We are so fortunate to have Emily O'Halloran with EMP Group here with us. It's crazy to think that it's already October, and here we are heading into Medicare enrollment season. Emily, thank you so much for being here and taking the time out for us.
Thanks for having me again. This is great.
Yeah, of course. And I know Liz and I depend on you and your team throughout the entire year, but particularly in this time of year where we get a lot of questions around Medicare, either from clients that are initially enrolling or clients that currently have Medicare. So we thought it would be great for you to spend time with us today, cover some of the basics, but then also talk about 2025 and some of the changes that may be on the horizon.
Absolutely. This is a big year with a lot of change. So you hear that every year, but this year it's true.
Great. And I know that you and your team are an invaluable resource to us. All the time. We have such a great experience working with EMP Group, but I thought it'd be good for you to start off with really who EMP Group is, what you and your team do, and then how you fit into a client scenario.
Absolutely. So we are an independent Medicare insurance agency. While we are based here in Tyson's Corner, we serve over 36 states now, I believe. So really very present in the Mid-Atlantic and the DC metro area, but throughout the country. And we're really growing. And so our mission, as really led by our founder, John Norse, is Medicare education. So everything starts with understanding Medicare better. Whether it's planning for Medicare and eventually having a successful Medicare journey, or if you're already enrolled in Medicare, the more that you understand about how it all works, the better your experience will be. So education is first and foremost for us. Mm-hmm. And then we also walk our clients through the whole enrollment process. And so we take care of that. Again, as independent Medicare insurance agents, we are able to provide a lot of different options that meet that individual client's needs. And then we're there for ongoing support. So things change every year, like the things that we'll talk about today. So even if nothing changes in your life, your plans can change, and we're there to help make those adjustments as needed. But also life changes. People will move, changes in marriage, all sorts of things will warrant a look at Medicare, and that's what we do for our clients on an ongoing basis.
Excellent. And I know for us, our bread and butter is the financial planning and the investments, but when it comes to something like Medicare, that's something that's so complex, so many moving parts, we just say, hey, we need to have a specialist that we partner with to make sure that we're getting not only this stuff right this year, but obviously as things change over time, that we make sure that we're aware of that.
Right. And I just wanted to ask also, because it is constantly changing, is there a way for our clients to sign up for a newsletter to stay kind of up to speed on what the changes are year to year?
Absolutely. So with that focus on education, our website is entirely educational. So at mpgroup.org, you'll definitely find a lot of resources that live there permanently that you can catch up on and read at your leisure. We do have a quarterly newsletter that you can sign up for. And this month, we just launched our series of short Medicare educational videos. This is our MP University. So if Medicare is something that you don't want to sit down and learn about for 30 or 45 minutes at a time, this is the perfect place. If you want to just bookmark it and watch one or two short videos a week, you'll be able to take on some of this complex new information in digestible bites. So thank you for asking.
Absolutely. Thank you.
It's a great idea. Awesome. Well, I know that we're going to get into some of the changes on the horizon for 2025, but a lot of the times when we initially get approached with questions about Medicare, it's a client's first time going through, the whole process. So I think it would be good for us to just spend a couple of minutes talking about, what Medicare actually is and just some of the basics before we talk about, things that are on the horizon.
Absolutely, especially in an election year and you're listening to a lot of discussion about these federal programs. You hear people refer to Medicare and you hear people who are professional commentators and analysts making references to Medicare, and in the next sentence they're referring to Medicaid, and they think they're saying the same thing, and it's just kind of eye-opening. Even people who are kind of in this work don't always understand the terminology and the difference in the programs, and because so many of us are not there yet to Medicare, it's sort of nebulous and something that you just know a little bit about. Maybe you have a vague notion of what it is. So these big election cycles always really highlight for me when I'm listening to people, wait, you just said Medicaid, and I know you mean Medicare, so let's talk about what the difference is.
That would be great.
Yeah, so Medicare is the federal program that provides health insurance to primarily seniors, so individuals over 65 in this country, and that's of all incomes. So Medicare is basically our health insurance program throughout the country for everyone once you're done working or once your spouse is done working. So it is not income related, that we will talk about how your income can impact what you pay for Medicare. Medicaid, again, often just kind of a term that gets confused with Medicare. Medicaid is a federal state partnership that provides health care for lower income individuals and families throughout the country. But as a federal state partnership, it looks very different state to state. That's a whole topic in and of itself.
Right.
But Medicare separately is made up of the federal program, which started almost 60 years ago with Medicare A and B. And so sometimes people will refer to their Part B, and they're really referring to their private insurance. A and B are strictly from the federal government. That's where it all started. We've built on it since then, but A and B is still the foundation for all Medicare coverage. Part A is called hospital coverage. Part B is called medical coverage. That's a little confusing. The way you want to think of it is Part A is admitted types of care, typically an inpatient hospital stay, skilled nursing, home care, hospice. Part B is outpatient care. One of the things that I think is really helpful to understand the evolution in Medicare costs is to take a step back and look at history and how healthcare has changed over those almost 60 years. So many things that we would have experienced as a patient 60 years ago in an inpatient setting, it's now outpatient care, which is wonderful, miraculous even, what we can do in healthcare now. But it does shift a lot of the cost under the Medicare program to the outpatient setting, shifting it to Part B of Medicare, and that people don't realize changes what you pay for each of the parts of Medicare.
Absolutely.
Got it. And we all know that, once clients are, in their early 60s, next thing you know, 65 is on the horizon. That's that big line in the sand. Can you just clarify who's eligible? And then, if somebody works at a bigger company or a smaller company, there seems to be a lot of, moving parts there also.
Yes. So the Medicare initial enrollment period is defined by your 65th birthday. However, some individuals will qualify for Medicare much younger, and that is through Social Security disability. But the majority of people will have their first Medicare eligibility at age 65. And whether or not that is their juncture to make the transition into Medicare has everything to do with how they are covered at the time that they're turning 65. So if they are on their own employer's group coverage and that employer has 20 or more employees, or if they're on spouse's coverage and they have 20 or more employees, then that's typically coverage that you can remain on and postpone Medicare enrollment. And there's a little bit more nuance to that as far as whether you would take just Part A temporarily and get Part B later. Those are the details that we help people map out through individual consultation. So we're often talking to people before they turn 65, taking a look at what their current coverage looks like and what their plans are for the years ahead. So if you are turning 65 and you say, I'm going to keep working 5-10 more years, we do want to look at what your coverage is. So small groups, people who are self-employed, all of those individuals do need to go ahead and make the Medicare transition. There are a lot of penalties and coverage delays associated with not enrolling in Medicare when you should. So it's really only those folks who are covered by an employer group plan of 20 or more employees, a large-ish employer, who can not start down the Medicare path at age 65.
I just want to elaborate. So if somebody is going to opt out, so when do they need to do that, and how involved do you get with helping them in that process?
Pretty involved. So
Okay.
to the extent that folks are interested in planning some discussion, we'll explain all of these parts in a lot more detail to them. We really like to break it down and talk about it and make it understandable. And so we'll determine things like whether or not this is someone who should take Part A. We'll explain all of that. The Part B is something that, again, is going to have, with Part A is premium free once you have enough work credits. Most of us have earned our Part A eligibility sometime in our 20s, so it's 10 years or 40 quarters. So Part A, as a no premium part of Medicare, is often something that people will just go ahead and take and keep working. Now, an extra layer of complication is that if I'm going to work past 65, if I have group coverage and I can postpone Medicare, well, I need to take a look at, do I like that coverage, and what does it cost us? If it is partially funded by me, I want to evaluate the cost of that versus Medicare. So that is something that we will help people do.
Okay.
And if we determine that their current coverage is a great value, we'll make that recommendation, stay on that, and then just keep us posted, because sometimes people will have a life-changing event like the loss of a job or deciding to lose that job. That can happen pretty quickly, and we'll want to help them make that pivot into Medicare as smoothly as possible.
Okay.
Got it. That makes sense. So, like a lot of things, it depends, and there's a lot more to the story, based on the individual.
Absolutely.
So, got it. And we all have seen the commercials over the years and all of the marketing about Medicare supplemental plans versus Medicare Advantage. Can you just unpack some of that? It seems like there's a fork in the road that somebody eventually gets to for what route they go based on those two options. We thought it'd be good to spend some time talking about that and some things to consider.
And the pros and cons. That'd be great.
Yeah, thank you. That is what we spend the majority of our time explaining to new clients. It really is the area where there seems to be the most confusion.
Yeah.
And has really significant ramifications. In most cases, what you decide when you first start Medicare can have a bearing on how you're covered for the rest of your life, which is kind of mind-blowing. I have to make a decision that might impact me for 35, 40 more years. That's a big deal. So we see the importance of that, and we like to take our time to explain it and help people understand that we don't ever want to see anyone close the door or take something off the table when it comes to healthcare choice. So the difference is that Medicare A and B, again, strictly a federal program, has a lot of out-of-pocket costs, and those out-of-pocket costs are unlimited. The most perilous financially is on the outpatient side, Part B. The coinsurance after meeting the deductible for the Medicare member is 20%. Well, 20% of an office visit, oh, no big deal, I'll pay that. 20% of a major outpatient surgery can really hurt.
Yep.
So we want to help people understand that, and that is where a Medicare supplement or a Medigap plan comes in. So that Medicare supplement is going to act as the secondary payer to Parts A and B, what we call original Medicare. So that's one model. The other model are those Medicare replacement plans, if you will. So Medicare Advantage, also known as Part C, is your other option. And that's where you're leveraging what you've earned and what you are paying for in Part A and B into enrollment in an all-in-one plan. And that plan is going to provide all of your inpatient and outpatient A and B benefits. Also typically will include your prescription drug coverage. So first difference is who is paying your claims. On the original Medicare side, it's literally the federal government that is paying the claims, with a private insurance acting as secondary. On the Advantage side, the federal government is paying these private insurance companies with whom they've contracted to offer the Advantage plans a fixed monthly amount to cover you, and then that private insurance company is paying your claims. So there's a bit more it's managed care in the sense that they are going to use tools like prior authorization requirements and, in many cases, referrals to see specialists. On the Advantage side, you're talking about network-based care. So there's going to be in and out of network providers, and that will dictate who you might want to see depending on how much out-of-pocket cost. On the original Medicare side, you can use all healthcare providers throughout the country who take Medicare. So you get away from that network-based type of healthcare. So those are some of the biggest differences, but I think in terms of the long-term impact, the one that people are least familiar with, and this is an important time of the year to talk about it, is how do I enroll in one of these plans? What's my period of eligibility?
Right.
The original Medicare with a Medicare supplement, that Medicare supplement, again, is a private insurance policy. And there is, in most states, there's a handful of outlier states, but in most states, there is a one-time opportunity to apply for that coverage and be guaranteed to be accepted. And that's when you first start Medicare, specifically Part B. That's a 6-month window, and it does not come around again every year. Our mindset as a country is there's an annual enrollment period for everything, and there's always going to be a time where my current health doesn't matter. My pre-existing conditions are going to be just fine if I wait to the right time of the year. In the majority of states, that is not something that is true about Medicare supplements. And we find time and time again that we talk to people who say, oh, I'll just get that in open enrollment, or I'll review. If I don't like my rate, I'll just get a new policy during open enrollment, they'll say. And it doesn't work that way at all. So it's a really valuable piece of insurance that if you want that type of Medicare coverage, you want to consider that when you first start Medicare, and then you want to recognize the value in that coverage. Even when your health is good and you're paying premiums, you're not seeing those premiums pay you back in what they're paying on claims. That's really meaningless compared to the future value of that policy potentially. So you want to learn to look at it that way. The Advantage plans are never tied to your health. They're always available during the annual enrollment period that we're about to go into. So very different in how you're eligible for them initially and year over year.
So once enrolled, how often should people be reviewing their plans and maybe evaluating if it's the right coverage?
Really, every year. Mm-hmm. Absolutely, regardless of whether or not you're in that first option where you have A and B and the secondary insurance, or in an Advantage plan. So with the first option where you have original Medicare and the Medigap insurance, you're going to have your prescription drug coverage in a separate piece of coverage. So that's where the standalone Medicare Part D plans come in. Mm-hmm. If you want to think of it like putting together a meal, it's an a la carte selection. So you're putting these pieces together to customize it. And that Part D is something that will change pretty significantly every year. So you want to be evaluating that. You can try to change your Medicare supplement any time of any year when you don't have that window of open enrollment or some other unique guaranteed issue opportunity. It's going to be underwritten. If you have great health, you can go for it. You can try to get a new policy throughout the year. On the Advantage side of Medicare, those Part C plans, those are going to change in terms of premium, which doctors participate. Sometimes plans will exit the market. We're seeing a lot of that this year. We're going to see changes in that plan's deductible, maximum out of pocket. There are a number of different components to the way that plan will be put together that can change every year, and you're going to want to pay close attention to that.
Okay.
Got it. And, clients that we work with that eventually, they're at these sort of benchmarks. They turn 65. Shortly thereafter, they'll retire. And, in most cases, they want to take a step back, spend time with, their family, friends. And a big other component of that is they finally want to travel. Mm-hmm. So of those two, different paths there, can you just talk about considerations for that travel dynamic if somebody, does have that in their plans?
Sure. So urgent and emergent situations are going to be covered in both scenarios. So wherever you are in the country, urgent and emergent care is just fine on an Advantage plan. With the Advantage plans, there can be PPOs that will have networks that include doctors throughout the country, or urgent care facilities, hospitals. So it's not always a very big deal. If you're traveling and you're spending a few months, maybe you have a new grandchild and you're moving in for 3 or 4 months, you might want to have that original Medicare model where you can see doctors throughout the country without any referrals, without a network. That's something that gives you a lot of freedom. Traveling overseas, there are a few Medicare supplements that will provide some emergency travel coverage, and we're seeing a lot more Medicare Advantage plans cover overseas emergencies. So emergencies are less the issue, but it's that amount that they'll pay and how easy is it to get what you might want, which might be a medical flight home or some sort of something that might not meet the threshold. So we definitely recommend purchasing health insurance for trip-specific timeframes. So
Okay.
for overseas travel.
Got it. Well, thank you for walking us through, the basics. That was a great overview and helpful just to get the basic, lay of the land. Let's transition and talk about 2025, some of the changes that may be on the horizon and, things that you're guiding clients about, that are on the front burner.
That is really what we're doing all day long these days. Yeah. So everyone who is currently on Medicare is getting a lot of correspondence, both from Medicare and from their current coverage right now. So one of the things that everyone will receive if they're a current Medicare member is a Medicare and You handbook for 2025. That is published by the federal government and it's sent out to everyone. So everyone should be watching for that. There's a good update in there about the changes to the program for this year. It's hard to make the case that it's objective. It's definitely intended to say, this is what the federal government is doing for you, and isn't it great? Mm-hmm. So I think it requires a little bit of dissection to determine which pieces really are great for everyone. I think what you'll see is a lot of change in benefits, more so than we've seen in past years. So whereas this is the time of year to also be watching for those documents to come in from your plan, this is something specifically that you're watching for called an annual notice of change. This is going to be a plan document that will tell you if doctors or whole health systems are leaving the network, if you have an Advantage plan, if you have a standalone prescription drug Part D plan. This will tell you if there are pharmacies that are leaving the network, if there will be a change in the monthly premium, if there will be a change in the deductible, or really what can be very significant are changes in the medications that you've been filling, if something is going to be in a higher tier with a higher copay or coinsurance. This is your document that you're watching for to give you all of that information. This year we're seeing many more significant changes because of some of the impacts from the 2022 Inflation Reduction Act. Mm-hmm. So again, with this being a big election year, there's a lot of talk about that. It was an element of the Inflation Reduction Act to bring down prescription drug costs for seniors. That is something that has been implemented in a variety of ways, some of which have already come to pass. So in the last couple of years, we've seen out-of-pocket costs for vaccinations go down to zero. That's a big change. That's something that really is saving people a few $100s a year because you were paying a really, really big coinsurance usually to get a recommended vaccine. So that's been a big change, a big improvement, something that was already implemented. I think we've all probably heard about the insulin costs going to $35 or lower. So that we've seen a couple of years of that. Something else that went into effect this past year, 2024, was the first year that there was no coinsurance, so no out-of-pocket for the Medicare member when they reached what's called the catastrophic stage of drug coverage. Mm-hmm. And I can tell you, having worked with some clients who have regular medication, so this is daily medication, life-saving, oral chemotherapy, oral immunotherapy, medications for pulmonary hypertension. it just would blow your mind if you saw the retail costs on these medications. I've seen retail costs of over $300,000 a year.
Oh my God.
So previous to 2024, when the Medicare member reached the catastrophic coverage stage, they still had an out-of-pocket of 5%. So we were seeing very, very high out-of-pocket amounts paid by Medicare members, even when they were covered on the plan that was doing the best it could of all the plans for what they take. So that was something that was really taken into consideration going into 2024. Well, it was part of the Inflation Reduction Act to eliminate that 5% coinsurance. So we saw major improvements for a very small number of people, but the improvements were so significant they were life-changing for those people and really warranted, I think. Going into 2025, we have another massive change, which is that the Medicare members' out-of-pocket cost on Part D, so covered prescription drugs, cannot exceed $2,000 starting in 2025. Now, that amount does typically, there's, of course, terminology that will indicate to what extent that can go up a little bit each year moving forward. That's going to happen. But for 2025, the maximum out-of-pocket, the first time we've ever had a maximum out-of-pocket on Part D, is $2,000. Now that's on covered medications. It's not going to address what you're paying if you're getting something through the mail order from Canada. It's just going to be what you're filling through your plan. And that's a big change. Along with that change, all Medicare Part D plan providers will now have something that people are calling an M3P, not MP3, but M3P, which is a prescription payment program. So if I have a medication that has a $2,000 out-of-pocket cost the very first time I fill it, and that's very possible. I don't want to spend it all in January.
Right.
So this is a program that all of the plans will now have to allow me to spread that cost over the year and just pay my prescription plan provider. So I think that will help a lot of people, but we're seeing some impacts on all of the plans. So while these changes are going to positively impact, we think about 14 to 15% of Medicare members, it will be everyone else who will, in a lot of ways, be paying more for their coverage.
So, like you said, for the insurance companies and the prescription drug companies, how are they digesting the overall increase in cost?
Yes, to be able to continue to contract with Medicare and offer prescription drug coverage, they have had to make adjustments in the structures of the plans. So what you may read is that the average Part D premium is going down slightly, but the truth is that there's a lot more to what you pay than your premium. So you might have had a plan with a very low premium, and you're getting your notice saying that all of your medications are changing tier and the deductible is going to be higher. You might need to switch to a plan with a much higher premium. So while the plan that you were on that had a low premium went down a couple of dollars a month, the truth of what the coverage is tells a different story, and now you're going to pay a much higher premium to have the same coverage. So not to simplify it, but it's like what they say with the rest of inflation. So
Right.
The bag of potato chips has fewer chips in it. So the Part D plan has maybe lesser coverage than what you were getting for the same dollars before, and you have to spend more to get comparable coverage. So that's kind of how you want to inspect your Part D coverage. What do I need to pay each month to have my out-of-pocket costs make the most sense? And just look at all of the elements, because the plans, in order to continue to provide this coverage, do have to increase deductibles, increase premiums, increase tiers. All of those things will change and will impact people who are used to having almost no cost. There's a big percentage of people who have very inexpensive medications, things that they're used to having a $0 copay for. Many of those medications will now not be so inexpensive when you look at the out-of-pocket cost.
Reason to just revisit their plan on an annual basis.
Absolutely.
So that leads me to, when is the perfect time to reach out to you? I know that open enrollment is getting ready to start, but when would be the best time, the ideal time?
So for people who are not on Medicare, we always recommend that you reach out and start the conversation to begin to learn about what Medicare is and how it's going to look for you potentially, and things can change. But we're having that conversation with people in their mid 60s before they're 65. We'll talk to people who maybe will turn 65 2 or 3 years before their spouse, depending on who might be the one who is carrying that employer coverage. Those will be considerations we'll want to look at. People will work past 65 and forego Medicare enrollment for that younger spouse to catch up. Sometimes we have kids who are on that employer coverage and we want to keep them on. So there are things that we'll look at that are the big picture of the client and how that impacts their timing. So we're very happy to have those conversations, and we all know how time flies. I'm constantly getting an email or a phone call from someone I talked to 2 or 3 years ago, and they're saying, okay, we're ready to retire. And it's like, wow, that felt like 3 weeks ago.
Right.
So that's the time frame that's great for people who are not on Medicare yet. And it really does allow us to identify things that would otherwise be a pitfall for you. So we'll explain that you should not go on COBRA coverage if you're over 65. Instead, you need to quickly get on Medicare. That's something that we've seen too many people make a mistake with, and they just didn't have the right conversation with someone who could teach them about that in time not to make the mistake.
Absolutely.
Things
it's
like
just
that.
not one size fits all.
Right.
Yes.
So we try to provide as much of that detail and just preparation, right? So preparation can begin a few years before you start Medicare. For people who are on Medicare, our current clients, we have a process of reaching out and reminding everyone this is the time of year to watch for your annual notice of change. This is the time of year to update us on how your life or your health might have changed in your prescription. So we have all of our current clients reaching out and scheduling an annual plan review. And then we're able to take on new clients who are on Medicare at this time of year. So reaching out through our website is a great way to connect with someone, to schedule a time where if you would like to share your current prescription information, that will really be analyzed against the 2025 plans to determine what we want to know is not one number. We don't want to find the plan that has the lowest premium or the lowest deductible. We want to see for what you take, what's your total cost for the year? How can we get that the lowest? In the process of having these conversations, whether with a current client or a new client, the other thing we're doing is explaining all of this background.
Okay.
Because people want to know why are things different? Why are my costs higher?
Right.
And we can provide that background.
So, okay, just to elaborate more, for the initial conversation with you, how does a client prepare?
We will email a list of things to have handy, and it's not very complicated at all. It's just really knowing what your current coverage is and what the cost to you is. Sometimes that's something people will want to double check, and it's more than just the monthly premium. If you have employer coverage and there's a high deductible, you want to take a look at that if you're contributing to an HSA. So all of those are things that you'll want to make sure that you have a good handle on your own current coverage. Doctors you're seeing, prescriptions you're taking, and then we'll get an assessment based on those factors plus where you live, and we'll take it from there. So it's really just kind of knowing your current costs for healthcare, and from there it will all sort of come out in the consultation process.
Sounds good. Okay, so as we know, everybody does get paid and I think, our clients ask, is this an additional payment with our financial planning? And I just want to, turn that over to you. How do you get paid?
I really like when people ask that because it makes me happy for people to know, because I think that we offer such a value. We are not paid by clients in any way. So there are no charges to work with us, but as independent Medicare insurance agents, we are compensated by the different plans, whether it's a Medicare supplement, a Medicare Advantage plan, or a standalone prescription drug plan, and in some cases, some of the ancillary products that we might offer, whether it's a individual dental or vision, hearing, something like that. What the client pays for that coverage is the same, whether they work with us, where they're going to get a lot of hand-holding, a lot of education, a lot of backup. or whether they go to a website, whether they call an 800 number, their actual premiums will be the same. We think that we provide the value in the education on how it all works, and we make recommendations that are just working with so many different companies, and the compensation is so similar as to be virtually the same. I love being able to focus on what's right for that client and make my recommendation. It's very secondary to what we do. Thankfully, I like it that way.
That's great. Okay, well, we really appreciate your time and your partnership. This is so valuable to our clients, and as you pointed out, it's a critical piece of the pie when it comes to retirement planning. But anyhow, thank you so much for your time today. And if you wouldn't mind just sharing again the best way to get in touch with you. I know you said your website, but if somebody wants to get in touch, wants to schedule time, what's the best way?
Definitely just going through that website, mpgroup.org. You'll find my information on there. You'll find information to connect with my whole team. So we'll just get you scheduled with either me or the next person that's available, depending on your sense of urgency. But we all work really closely together. I know everyone says we all work collaboratively. We really do. It's a great organization. Our objective is to just get people seen and helped as quickly as possible. So going straight to the website is the way to do that. And definitely very proud of what we have launched this month with our MP University videos. I think it's a great solution for taking a topic and breaking it into those small digestible pieces, which more than people who will soon be Medicare eligible or people who are on Medicare, there are so many of us who have parents who are on Medicare who have no knowledge whatsoever of the program. And the wrong time to learn more about what your aging parents' health care looks like is when they're in a healthcare crisis.
Right.
At that point, there's no time to learn everything. So it's not as if we all don't have a lot of projects on our plate, but for anyone who is seeing that they're spending an increasing amount of time helping an aging loved one with their health care and they're thinking, I don't know what any of this means, we think our website and specifically our MP University videos will answer some of those specific questions. You can click on one topic and just watch a video that will explain that one topic and come back to it over and over again as things start to come out that you want to understand better. So Medicare is not just for people who are on Medicare or almost there. It's for all of us to understand better. It's something that we're paying for as a nation, all of us individually, and it's something that we want to be there and be working well for us when each of us gets there too.
Well, again, we really appreciate your time. This has been very beneficial, and we will make sure that everybody knows how to get in touch with you. And we, again, look forward to working with you in the future. Thank you so much.
Thanks for having me. I love talking about Medicare, so this is always a good time. Thank you.
Thank you for listening to this episode of the Live Great Review. If you like what you heard, please subscribe to our podcast on iTunes or Spotify and recommend our podcast to family and friends. To learn more about VLP Financial Advisors, please check out our website at vlpfa.com. Thanks again.
And now for our necessary disclosures. Securities and advisor services offered through Cetera Advisor Networks, LLC, member FINRA SIPC, a broker-dealer and registered investment advisor. All investing involves risk, including the possible loss of principal. There is no assurance that any investment strategy will be successful. The views stated in this podcast are not necessarily the opinion of Cetera Advisor Networks, LLC, and should not be construed directly or indirectly as an offer to buy or sell any securities mentioned. Due to the volatility with the markets mentioned, opinions are subject to change without notice. Information is based on sources believed to be reliable. However, their accuracy or completeness cannot be guaranteed. Past performance does not guarantee future results.